Good morning. So this is Dr. Ahmed Haswan from University of Sharjah, College of Medicine. And today we're going to demonstrate the examination of the spine. So first of all, as we're used to, any musculoskeletal examination has sections that we're going to go through. So the first section is the introduction, then as usual is the look, feel, move, then finally we do the special tests, and then we end up with a closure. So first of all, I would rather introduce myself to my patient. So hello sir, good morning. My name is Dr. Ahmed. I work here in the University of Sharjah College of Medicine. My senior doctor instructed me to examine your back today. Is that fine with you? Do you feel the place is private enough?
Yes.
I would like to assure you that everything will remain confidential between you, me, and my senior doctor. Do you agree to that, sir? Is that okay? Okay. So now, once the patient gives me the consent, the verbal consent, I would have to do 3 points. So first of all, I would have to wash my hands. Then I would put the patient in the proper exposure and positioning. So first, I will start by washing my hands. Now, the proper exposure for this examination would be the patient chest, abdomen, of course, and back should be exposed. So I would like to ask you kindly to remove the shirt, please. Then the proper positioning for the examination. Most of the exam will be while the patient is standing, but I will need the patient to be lying supine or prone, depending on maybe if I'm doing some special tests. So first of all, as usual, before we start the actual inspection, I would like to take a general look at the patient. So first of all, can you stand up please? So the patient now is in the correct positioning and exposure. So first of all, as we're used to, we have to take a general look at the patient. So is the patient ill or well? So the patient looks well, he's not in acute distress. So now I can proceed with commenting specifically about the back. So can you turn, sir, please? So starting with the inspection, first of all, I would inspect the patient while he's standing. The inspection would include the usual compositions of the joints. So the joint is composed of bones, muscles, skin. So we would we would want to look for any bony deformities, like obvious fractures or dislocations, any asymmetries between the two shoulders or scapulae, then any signs of muscle wasting, atrophy, so among the back muscles and the spinal muscles. Then finally, I would take a look at the skin. So does the skin show any signs of inflammation, like redness, swelling, any scars that may indicate previous surgeries, or any creases? Now, since we're examining the back, and for all the back and lower limb joints, we have to inspect the patient while he is walking, so the gait. So the inspection has 2 parts: while the patient is standing, erect, and the second part is while he is walking. So the spine examination, the hip, the knee, the ankles, all of these joints, we call them weight-bearing joints. So the patient has to be examined and inspected while he is in the weight-bearing condition. So please, sir, can I ask you kindly to take a walk? Okay, and can you come back, please? So while the patient is walking, again, I should comment about the symmetry of the gait. So is the gait symmetrical? Does the patient have any limping? And if the patient has any obvious deformities while he is walking. So it seems that everything is normal. The patient has no obvious deformities and no obvious asymmetry. So this was for the inspection. So this is the first section of the examination. So look, now we go to the feel or the palpation. Now in the palpation, we're used to comment on mainly 4 points, which are the bony prominences, the muscles, the temperature, and the distal pulsation. Now, usually in the upper and lower limbs, we comment on distal pulsations because this could be affected by joint swelling, which may impede or occlude the neurovascular bundle. But actually in the back examination, this is not the case. That's why we're not going to comment on the distal pulsations. Rather, we have one point else to mention. So first of all, let's start with the bony prominences. So the bony prominences, can I ask you please to turn on? So the bony prominences, I would start with, of course I'm going to go all over the spine. So I will start with the occipital protuberance, where just below it I have the base of the skull. Okay? So here is the base of the skull. Then here I can find the start of the cervical spines. Okay? So I would go over the spines of the vertebral spines. Then this is the most prominent one is of course the C7. Then I would go over the spinal processes and over all the vertebrae until I reach the level of the L5 or the sacral vertebrae. So what should I comment? I'm commenting mainly about tenderness. So was there any tenderness? Was there any deformity that I have sensed while I'm palpating the bones? Actually, I should ask the patient, sir, any pain or tenderness? Okay, so the patient says there's no pain. And of course, during the examination, while I'm palpating, I should keep my eyes on the patient's face, just monitoring him if he has any grimacing that may indicate tenderness. Now, next is when I reach the end of the spine, just go laterally and palpate for the sacroiliac joints. Okay? So the bony prominences, then the sacroiliac joint. Now next, I would palpate for the muscles. So the muscles that I'm going to palpate for are the trapezius muscles, the sternocleidomastoid muscles, then the paravertebral muscles, or the erector spinae. So how am I going to palpate these muscles? So with the tip of the fingers, I would go over the sternocleidomastoid muscle, then over the trapezius muscle, then finally along the paravertebral muscles. And again, my comment should be about the pain and tenderness, if the patient has any, and of course, if I'm feeling any obvious wasting or atrophy of the muscles. Next is the temperature. Of course, the temperature here in the back, I don't have to compare, so I will do it with only one hand. With the dorsum of the hand, I would go over the cervical spine, then over the thoracic, and finally over the lumbar spine, and compare between these feelings. And of course, at the end, I would report if there is any temperature discrepancy. Now, the last point is, while doing the back examination, doing the palpation part of the back examination, is feeling for a cervical rib. So from behind the patient, I will just dip my hands, okay? So can you see like this, okay? So I should stand behind the patient. I would dip my hands in the supraclavicular fossa. Now patients with a cervical rib, it means that a rib that originates from the cervical vertebra, apart from the normal situation which starts at T1. So those patients, they might present with various types of symptoms, including numbness, weakness, especially in the upper limb. So simply I can feel it, I can feel for it by just dipping my hands in the supraclavicular fossa. Okay. Now the next section would be the move. So the movement part actually includes asking the patient to do certain movements. Again, please, just to make sure that we do not instruct the patient to flex, extend, adduct, abduct, because these are medical terminology. So what we do is, we ask the patient simply to mimic our movements, okay? So, sir, I'm going to ask you to do certain movements. Please just do as I do, okay? So now we have two parts, actually, the spine examination. The first section is for the cervical spine. The second section is for the thoracolumbar spine. Now, they have the same movements, and we'll see now how to do it. Now, for the cervical spine, we have, number one, the flexion and extension. Okay, sir. So can you please do like this? Okay. Then look up. Okay. So the patient, first of all, thank you. So this is flexion, where the patient's chin touches the patient's usually chest or sternum. Then we can simply ask the patient to look at the ceiling, which is the full extension. Now, can you please do like this? Okay. And on the other side. Okay. So as much as possible, try to ask the patient to tilt his head to both sides, and this is called the lateral flexion. Now the last one is the rotation. So can you please do like that? Okay. So this is turning the head. Okay. So the first one was tilting the head. This is turning the head to either side, right and left, and this is called the rotation. Of course, these movements are done actively by the patient, and we will not do them passively. So it's just done actively. Now for the thoracolumbar spine, it's the exact same movements, but the actual technique will be different. So for the flexion and extension, so I will ask the patient to try as much as possible to touch his toes. Can you please go down, please, and touch your toes as much as possible? Okay? So can you see the patient? Thank you. So this is flexion, and of course, please make sure that the patient doesn't bend the knee. Okay? Now for extension, of course, I have now to support the patient. Can you please stand? No, can you stand like this, please? Okay. So this is my patient. When I ask him to extend, this has a risk of fall. So what should I do is, I will hold the patient from the hip joint, from the waist. Then can you please go back? No, back. Yes. Okay. So I will support the patient. Okay. Thank you very much. Okay. So this was extension at the thoracolumbar vertebra. So now we've done flexion, extension. Next thing is the lateral flexion. So the lateral flexion, simply I will ask the patient to put his hand on the side and slide it as much as possible. But again, I'm going to support the patient. So can you please go like this to the side? Yes. Okay, very good. Thank you. The other side. Thank you very much. Okay. Now this was lateral flexion on both sides. Now the last part, or the last movement, is the rotation. Now the rotation, if you ask the patient to do it while he's standing, actually the movement will be included also from the hip joint, which we want to exclude. So what we're going to do is, we're going to ask the patient to, can you please sit? To sit, of course, in a 90 degrees position. Then he can rotate now. Okay? So can you please rotate? Like this? Yes. Can you please? Okay, thank you very much. So now the patient has done now the rotation, and this rotation was exclusively from the thoracolumbar spine. Okay. Thank you very much. Now the final part would be the special test. Now the special test, we have 3 of them in the back. The Sharjah test, the straight leg raising test, and the femoral stretch test. Okay. So now, can you please stand up? Okay. So now for the Sharjah test, I would just like to explain it briefly. So this test, actually, what we're going to do is, we're measuring with a measuring tape distance between 2 points. Then actually we're going to measure it while the patient is standing erect and while he is in flexion. So how can we do that? So simply what we're going to do is, we're going to draw an imaginary line. So let's say that this is the iliac crest of the patient. So usually the iliac crest is at the level of L4 vertebra. Then I will just go down until I reach the level of L5. Now, on the L5 vertebra, this will be my reference point. So above it, I will go 10 centimeters, of course with a measuring tape. And so this is 10 centimeters. And here I would put a mark. Okay. Then I would go down 5 centimeters. And then I would put another mark. So actually the full distance here is 15 centimeters. Of course, this is while the patient is standing erect. Next is, I would ask the patient to flex his back, as what we've done in the movement. So when he flexes his back, I'm expecting this distance to be increased. So actually it should be, for example, now 21 centimeters. Okay? So I would measure the difference between 21 and 15. Of course, it's 6 centimeters, which is normal. So above 5 centimeters difference is normal. And we're going to show you how to do it clinically. So simply, I would ask my patient, can you please face here? So I would use, of course, the measuring tape. So first of all, this is the iliac crest. Of course, I have to feel it, the iliac crest of the patient. Okay, so this is the level of L4. Okay, so this is the level of L5. So what I'm going to do, I'm going to use this sticker to mark the level of L5. Now then I would go 10 centimeters above. So this is 10 and this is 0. So I would place another mark here. And then I would go 5 centimeters below, which is around this level. Okay? So the total distance now I have is 15 centimeters. Sorry. That's fine. Thank you. Thank you. So 15 centimeters. Now I'm going to ask the patient now to flex his back, and I'm going to measure this distance again. So can you please go and touch your toes again? Okay. So now I'm taking the measurement. Okay. Thank you very much. And this is what I got. The new reading is 21, and this means that there is 6 centimeters difference, which is normal. So at least I have to have 5 centimeters difference. So it means that I should get a 20 centimeters reading when I ask the patient to flex his back. Thank you very much. I will just remove these stickers. Now, can you please lie down? So the remaining 2 special tests are the straight leg raising test and the femoral nerve stretch. So actually these tests are designed to stretch a nerve which could be compressed, usually in the lumbar spine. So first of all, the straight leg raising test, this test has to do with the sciatic nerve. So the sciatic nerve actually passes on the posterior side of the posterior compartment of the thigh. So what we're going to do is I'm going to hold the leg, one leg, from the ankle, and I will relax. I will elevate it for the patient, okay? Elevate it above the level of 45 degrees. And of course, I look at the patient's face. Now, if the patient has any pain or tenderness or actually tingling in the distribution of the sciatic nerve, then this will be positive for compression of the sciatic nerve. Or we can say that the straight leg raising test is positive. Now, if it's negative, then what I can do is I will do a slight dorsiflexion. Now, this will even enhance more the stretch of the sciatic nerve. So again, from the beginning, I will raise the hand, the patient's lower limb. I keep an eye on the patient's face. Then, if there is no pain, no tingling, I will do the dorsiflexion. And again, any pain? Okay, thank you. And of course, I will repeat it for the other leg. Now, the last test is, I would ask the patient, can you please lie on your belly? So the patient has to be in the prone position. Now I will do, more, yes, thank you. Now I will do the same, it's the same idea, but now I'm stretching another nerve, which is the femoral nerve. So simply I will flex, relax. So I will flex the knee, then I will extend the hip joint, okay? So flex the knee, extend the hip joint. By this, the femoral nerve, which passes anteriorly, will be stretched, and if the patient is having any compression to the femoral nerve, he will again be having pain and actually maybe some tenderness or some tingling in the distribution of the femoral nerve. Thank you very much. Now, to conclude my examination, I have to mention that I have to do the full upper and lower neurological examinations along with the abdominal examination, as there are some abdominal pathologies that may radiate or present with back problems. So this is the end of the session. So at the end, of course, I would thank my patient So thank you very much, sir. I will report the findings to my senior doctor. Okay, thank you very much.